Doctors insist changing the current vaccines to target COVID variants is a relatively easy process. But if necessary, just how swiftly would companies roll out those new formulas? And could they just debut them as soon as they're ready? Vanessa Ruffs joins us to verify.
Lots of folks are talking about the process for tweaking COVID vaccines to target those variants, wondering if companies could just roll out adjusted vaccines whenever they're ready, or if there would be more hoops to jump through. So we're asking, can companies adjust their vaccines to target COVID-19 variants without approval? Our sources are the FDA, South Carolina's Senior Deputy for Public Health, Nick Davidson, and infectious disease specialist with Atrium Health, Dr. Katie Passaretti. So how would debuting an adjusted vaccine work?
It's not like immediately flipping a switch.
In February, the FDA released updated guidance on this topic, saying that companies would have to request an amendment to their initial emergency use authorization. They'd have to provide data on how well the modified vaccine works and show there's an actual need for it. Companies would also have to show the manufacturing is similar to the original vaccine, and if it's not, explain why. So yes, there's a bit of a process in adjusting the vaccines, and it doesn't stop there with the approval.
It's a combination of science takes a little while and making sure that the changes are safe and they're only really to kind of strain content.
It will be time consuming to ramp up the production of any alterations in a vaccine.
So we can verify, no, companies can't just change their vaccines to better target the variants without getting FDA approval. It is important to note, though, doctors say that our current vaccines are still safe and effective against those COVID-19 variants. With your Verify, I'm Vanessa Ruffs.